Respected Chairperson, thanks for the nice introduction. And my talk today will be a real-world evidence. Okay, what's the case? So previous speaker, Dr. Sheila, has highlighted about 2 cases, and she discussed about the various options, discussed about how to proceed with the cases. Now, what happens if you prescribe this molecule Mounjaro, if you have started this medicine? So, this is a Lilly-sponsored program. I have been contracted by Eli Lilly. Slides have been given by them. And before going to my talk, and the second portion of my talk will be very interesting. Most of you will be waiting how to prescribe, what are the precautions we should take when we prescribe the Mounjaro. And these are the approved indication for Mounjaro. There's number 1 is type 2 diabetes. Mounjaro is indicated for the treatment of adults with insufficiently controlled type 2 diabetes mellitus as an adjunct to diet and exercise. As monotherapy when metformin is considered inappropriate due to intolerance or contraindications. In addition to other medicinal products for the treatment of diabetes. And the second part of indication is chronic weight management. It's indicated as an adjunct to reduced calorie diet and increased physical activity for weight management, including weight loss, weight maintenance, and in adults with an initial body mass index of more than 30 BMI and more than 27 BMI in the presence of at least one weight-related comorbid conditions like hypertension, dyslipidemia, obstructive sleep apnea, cardiovascular disease, prediabetes, or type 2 diabetes mellitus. These are the indications for it. So as I mentioned, this is a first case, patient with obesity without diabetes. So our patient is a 48-year-old obese, overweight woman on diet and lifestyle for further advice on management of obesity. So she is a 48-year-old perimenopausal woman, multiple attempts to lose weight with limited success and regained weight later, and a history of snoring at night. So comorbidities, look at that. BMI is more than 30, 31, and weight is 84 kg, and weight circumference is high, 85 centimeters, and BP is slightly high, and family history, mother had a history of obesity, type 2 diabetes, had suffered myocardial infarction at the age of 54. That's an indication. Okay. So look at this, weight circumference high and BMI high, and the patient followed a balanced nutritional Indian diet along with regular walking and strength exercises. And as she, for the past 5 years, she was on various medications, lifestyle modification and some drugs. So she was initially lost weight in the year 2023. Again, she regained weight. Now her weight is 84, 85 and weight circumference is 85. Why maintaining a healthy weight is important in this patient? So because weight management is not merely about aesthetics but essential for health outcomes and quality. She has strong family history of coronary artery disease, which her mother had at the age of 52 itself. So improves metabolic health, lowers risk of diabetes and heart disease, and enhances quality of life and physical mobility. Optimal body composition supports strength, endurance and agility, and preserves lean muscle mass during exercise-mediated weight loss, improves social confidence and mental well-being. Why she was prescribed tirzepatide? So tirzepatide demonstrated significant reduction in body weight. So it has been proved 16% reduction in body weight with tirzepatide 5 mg at 72 weeks itself, and 22.5% reduction in body weight with tirzepatide of 15 mg at 72 weeks. So maximum dose is 15 mg, that gives 22% reduction. And 4 out of 10 people taking tirzepatide 15 mg demonstrated weight loss of more than 25%. This is a phenomenal. These other molecules cannot match. In comparison to semaglutide, tirzepatide showed significant reduction in body weight and weight circumference with improved cardiometabolic parameters thanks to the dual blockage. Okay. So 40% higher mean weight reduction on tirzepatide versus semaglutide was notified. This has been highlighted by the previous speakers. And participants on tirzepatide, maximum tolerated dose, experienced 8 inches reduction in weight circumference at 72 weeks. This is also a very phenomenal thing. So many people will be concerned about, not even concerned about weight, they are concerned about the weight circumference. For this molecule is very good. And of course, there will be 7 to 8.2 millimeters of mercury of reduction in systolic BP, and 4.6 to 5.5 millimeters of mercury reduction in diastolic BP, and minimum 14.6 centimeters to maximum 19.9 centimeters reduction in weight circumference. And of course, triglyceride, HDL cholesterol, LDL cholesterol reduction is additional pleiotropic benefits. And for our patient, model patient, the treatment plan was, weight loss target was 15 to 20%. The patient was initiated on tirzepatide 2.5 mg subcutaneous injection once weekly for 4 weeks. And after 4 weeks, dose was escalated to 5 mg. Further escalation to higher doses depends on the treatment response and tolerability in the patient. And the recommended maintenance dose was 5 mg, 10 mg, 15 mg. And because he is not a diabetic, the concomitant dosage reduction is not required. And lifestyle intervention is must while you prescribe whatever the molecule, any GLP-1 receptor based therapies. And our patient significantly reduced weight and circumferences after 6 months. So look at that. Baseline, 85 kg, 84 centimeters, 82, 81, 80, 78, uniformly. Both weight circumferences and weight is coming down. After 6 months, beautifully she has reached the 72 kg and 71 centimeters of weight circumference. Of course, look at the laboratory parameters. So from the baseline 6 HbA1c, 5.4 at the week of 36 and 72 weeks, 5.4%. So almost reversal of this pre-diabetes. This was Dr. Adeline Rina highlighted. And fasting sugar from baseline 110 to, it has come down to 100. And LDL cholesterol has come to from 113 to 102. Of course, other parameters. So the clinical improvements were reduced to food cravings, that is the main important thing for this patient, and improved appetite control, enhanced energy levels with overall quality of life, improved physical movement and mobility. Snoring was resolved with improved quality of sleep. This is also one important advantage this patient developed. To summarize, from 84 kg, she has come to 71 kg. 85 centimeters weight circumference, she has come to 72. 31 BMI to 26. And BP also has come down. So, patient achieved substantial weight reduction with body weight decreasing from 84 kg to 71 kg, and BMI improved significantly, weight circumference improved, cardiometabolic improvements were associated with enhanced physical activity and overall quality of life. Coming to the second part of my talk, that is starting and continuing Mounjaro. The dosing is similar for both indication, whether it's a diabetes or weight management. So start Mounjaro at lower dosage, that is minimum 2.5 milligram starting dose. After 4 weeks, escalate to 5 milligrams. If needed, you can continue to increase the dose by 2.5 milligrams after at least 4 weeks at the current dosage. So recommended maintenance dose are 5 mg, 10 mg and 15 mg. 15 mg is the maximum dose. So these are the pens, quick pens available for various color coding for various milligram dosage. So Mounjaro is a multi-dose device delivering 4 doses for one pen contains 4 doses. So every month patient has to purchase 1 pen. So this quick pen contains 3 ml of tirzepatide. This I think most of you know, most of you are using it, and I am using. And each dose delivers 0.6 ml of tirzepatide. This point you should notice. And for additional 0.6 ml will be there. After using 4 doses of there will be some amount of medicine will be there. That is for priming for every dose. So 2.5 mg quick pen delivers 2.5 milligram per 0.6 ml. So we have to educate the patient because of the possible GI disturbance, GI side effects. Okay. So the most common adverse events with Mounjaro were gastrointestinal in nature, were mainly transient. You should note the point, it's a transient. Many people, only few days they will have the symptoms. After few days they will become normal, and some people will have for few weeks. Okay, so for the advice we have to give is eating smaller portions more frequently, being mindful to stop eating once full, avoiding eating when not hungry. We should advise the patient, being summer, we should advise the patient to be hydrated, and avoiding high fat or spicy food, moderate intake of alcohol or fizzy drinks better to avoid. Of course, alcohol, we should tell them to stop it. Of course, some people, they say the alcohol craving has come down after starting this molecule. This is one additional pleiotropic benefit. So these are the practical considerations. So dosing in special population, no dose adjustment is needed based on age, gender, race, ethnicity or body weight. Irrespective of body weight, irrespective of gender, irrespective of things, we can give the same pattern, 0.25, 2.5, 5, 7.5, like that. And in hepatic and renal impairment, there is no dosage adjustment is required. And experience with the use of Mounjaro in patients with ESRD and severe hepatic impairment is limited. Caution should be exercised when treating these patients with Mounjaro. And adding Mounjaro to existing antidiabetes medication, metformin alone or SGLT2 combination, no dosage adjustment is required. But when already patient is on insulin secretagogues like sulfonylureas or insulin, definitely we should tell the patient to monitor frequently. Definitely it should be down titrated, both sulfonylureas as well as insulin, because this Mounjaro may potentiate the hypoglycemic action of this insulin secretagogues. Per se, Mounjaro will not produce hypoglycemia, that's sure. Or in combination with metformin, it will not produce hypoglycemia, like other DPP-4 inhibitors or like other GLP-1 receptor analogs. So there will be some words about pancreatitis. Suppose if already one patient is having history of pancreatitis, better to avoid starting this medication. While you should prime the patient about the symptoms of pancreatitis, and if pancreatitis is suspected, stop the molecule immediately, and diagnosis should be confirmed by doing amylase, lipase and other this ultrasonogram. And for people going for surgery, because of this gastrostasis, paresis, so they may have risk of vomiting during surgery. So 3 days before surgery, we have to stop this Mounjaro or any other GLP-1 receptor agonist. Few words about diabetic retinopathy and NION. Okay, Mounjaro has not been studied in patients with retinopathy, recurring acute therapy or proliferative diabetic retinopathy and with diabetic macular edema, and should be used with caution in these patients in appropriate monitoring. Mounjaro has not been studied in patients with NION, and NION was not reported in patients with SURPASS or surmountide. This is a very important point. Per se, the drug will not produce NION or diabetic worsen than diabetic this retinopathy. In case patient reports blurring of vision or any ophthalmologic issues, he should be referred to ophthalmologist immediately. Special situations like pregnancy, Mounjaro should not be used during pregnancy, because if a patient wishes to become pregnant, Mounjaro should be discontinued at least 1 month before the planned pregnancy. Coming to the fertility, so some centers, to reduce the weight, to favor the fertility, they will use this molecule. And the effect of Mounjaro on fertility in humans is unknown, but animal studies with Mounjaro did not indicate direct harmful effect with respect to fertility. So as I mentioned earlier, 1 month before the planning for pregnancy, we have to stop this. Regarding oral contraceptives, many oral contraceptives, they have drug interaction with many molecules. So similarly, Mounjaro may have, but no studies have been highlighted. So better to stop that oral contraceptives once you use this Mounjaro. Go for the other way of contraception, the barrier contraception method. Coming to the breastfeeding, it is unknown whether Mounjaro is excreted in human milk, so a risk to the newborn and infant cannot be excluded. And a few words about medullary thyroid cancer. The Mounjaro therapy increases blood calcitonin levels in a known, it's a known mild adverse effect. Incidence was common amongst people with obesity and uncommon among people with type 2 diabetes. Personal and family history of maximum multiple endocrine neoplastic syndrome was an exclusion criteria for the SURPASS or SURMOUNT trials. So in the SURPASS and the SURMOUNT trials, no cases of MTC was reported. And there have been reports about the suicidal tendencies with the GLP-1 therapies, but no reliable scientific evidence links tirzepatide as adverse mental health effects, including suicidal identification and suicide. And FDA preliminary review shows no causal relationship between tirzepatide or other GLP-1 therapies and suicidal thoughts and actions. And FDA has requested the removal of suicidal behavior and ideation warning from GLP-1 receptor agonist medications, as their evaluation does not identify any increased risk. Previously, it was mentioned as a risk for suicidal tendency. So PRAC evidence does not support a causal association between GLP-1 receptor agonist. MHRA UK concluded there is no established causal link between GLP-1 receptor agonist and suicidal behavior. So this is many people will ask, they will miss the dose. So this is a useful tip. If a Mounjaro dose is missed by less than 4 days, usually many patients favor Sunday dose. So usually they will be taking on Sundays. If they miss Monday dose, no problem. They can take it on Tuesday. If they do it Tuesday, Wednesday, like that, until Thursday, that is less than 4 days, soon we can initiate thing. Suppose 4 days has gone, patient notices only on Friday, or patient drug is available only on Friday, skip that Friday, Saturday, restart from next Sunday. This is what the guideline says. For example, if the patient regular dose is on Sunday, so Monday, Tuesday, Wednesday, you can take a dose. Thursday, Friday, Saturday, don't days. Again, you restart on Sunday. So thanks for your discussion. So I think we can go for discussion.